Hi, Dr. Henry and Minister Dix. Thanks again for taking our questions. My question today is regarding, again, if you could explain the evidence-based rationale behind not making masks mandatory in schools, because we're hearing now from the BCTS that they're not going to listen anymore, and they're going to ask people to wear masks as often as possible in schools in any situation. So is this a situation where certain communities where case numbers are out of control could benefit from making masks mandatory in their schools?
Yeah, so schools are not public spaces where we're with a variety of different people that we don't know on a repeated basis. What schools have are individual COVID safety plans that meet certain criteria. So you're with the same people every day. You don't have people walking in and out. So masks are an important part of some areas of schools, in particular when you're in common areas, when you're with mixing, passing by people in other cohorts, etc. And absolutely, I think that you should encourage mask use, particularly for the adults in the school setting, and that is something that we've been working with them on for quite some time. And we know that teachers have been involved in all of the COVID safety plans in a school. So it's similar to other workplaces where you have plans in place for how you manage within your workspace, not the public areas of a building, for example. So there are COVID safety plans that do include mask wearing in the schools.
Do you have a follow-up, Marcella?
I do. It's regarding if Minister Dix could explain again the influenza situation, where how do we know it's not as prevalent, or maybe Dr. Henry could explain this as well. How do we know that the flu isn't as prevalent this year as it has been in past years, and what do we owe that to?
Yeah, so we have a very detailed influenza surveillance network in the province that we've had for many years, run at the BC Centre for Disease Control. And there's influenza surveillance bulletins that are on the BC CDC website. And we have a number of different things that we monitor over time. It's one of the networks that we used early on to try and piggyback and do testing for COVID way back in January and February. Because we know that people with respiratory symptoms get tested for influenza. We've had to modify it because people aren't going as frequently to physicians' offices because there's a lot of virtual care. So one aspect of our influenza surveillance is what we call sentinel physician surveillance, and we're now using the COVID testing sites. So a certain proportion of the tests that are done at the COVID testing sites are also tested for influenza as a way of doing surveillance across the province. We also have anybody who's in a physician's office with an influenza-like illnesses who gets tested. We follow those swabs, and we look at the emergency department data around people coming in with influenza-like illness. So there's a whole different categories of types of surveillance that we pull together, and once a week there's a surveillance report, and all of the influenza viruses across the province and across the country are typed, and we report some of that to the Public Health Agency of Canada, and in turn to the World Health Organization. There is a global influenza surveillance network that our BC CDC Public Health Lab is part of as well. So there are many different things we look at, and generally this time of year we start to see influenza increasing. We'd see maybe about 700 to 800 positive influenza tests at our lab by now, and I think up until last week, we saw somewhere around 7. So we are quite confident that we are looking for it, and we're not seeing a lot of influenza circulating right now. We think and we hope that this will continue, and is partly because of the measures that we have in place to prevent transmission of COVID-19, because it is transmitted in very similar ways through droplets that we inhale from somebody who's been sick. So the fact that everybody's going out and getting immunized is very helpful as well. And we saw this in the Southern Hemisphere, so we're hopeful that that will continue. it is also something that gets into our long-term care homes every year. And so we are monitoring anybody who has symptoms in long-term care, gets tested for influenza as well as for COVID. So there's a pretty detailed influenza surveillance network, and we've been using that as well to help us understand how COVID has been transmitted over the past number of months as well.